I was too. I even liked the other gals about the Wildebrands. I mean,
So
von
the
Wildebrands.
Wildebrand was hard for me to hear. I couldn't hear her very well. I wish she would have talked louder.
Well, she had a thick Filipino accent too.
Yes. Yeah. So
But her slides were on point. I was like, I learned something. I ain't gonna
right.
lie,
Even me.
and especially with Cheryl's, I learned something. And
I did too.
I think we all brought that to the table that day.
I don't know
And
if you yeah, I don't know if you know him. His name's Mark Steven. Do you know who Mark Steven is? You ever heard of him?
where is he?
He's a flight nurse. He's here.
Uh,
He
I
I
do
posted
not.
a I posted a picture about, the conference, and he said, just had a patient the other night with tumor lysis syndrome, and I haven't seen this since nursing school. I was like, holy
Wow.
shit. So that's why I was fascinated, because as an ER nurse, we might see it. Because that was one
Right.
thing I asked you, Nelly. Why? Because somebody asked me that when I posted that I was coming to your conference. Why should me, an ER nurse, care about cancer and cancer patients?
That's an easy question to answer. I
Answer
mean,
that for us.
it's assumptive that they're going to go into the outpatient clinic and just get their therapy and go home and be all hunky dory. You know, Antibiotics and other like standard of care drugs and other diseases. Everything has a side effect,
Right.
and there's a risk versus benefit. And what do chemotherapy normally do historically? Especially you let's go back 10, 15 years ago when we had less antiemetic drugs
Oh
and
yeah, that's right.
less long acting antiemetic drugs. So you would see them like on the daily just barfing their guts out, or
Right.
having like massive diarrhea because we didn't have like standard protocols um, for like antiemetics, hydration, pre and post chemotherapy, and or like telling them to take Imodium or something for loose stools and setting that up, or even writing prescriptions for like Lomatil or whatever. So
So let me
it's a
ask you a
very important
let me ask you a
to
stupid question though.
yeah.
You said protocols. So do you have protocols in place now, like for your
There
chemotherapy
are a
patients?
lot of standard protocols that hospitals now have with certain highly emetic